Good afternoon, everybody. This is Mark Lynn with Healthcare Business Specialist, and welcome to the Show Me the Money, a beginner's guide to grants and payment management system with Elizabeth Burrows and with Kara Gambill. This will help you to get that money. Now that you've gotten the grant, now you need to get your hands on the money, and you have to go through a payment system. Unlike the other grants that you've received where they just put the money in your bank account, that's not the case with the grant that you guys just received a few weeks ago. So that's the purpose of this webinar today. We thank Elizabeth Burrows with Burrows Consulting for helping us do these to help educate you guys on how to get the money. There's my contact information. If you are going to email about questions about grants and grant management, Elizabeth is the person that you need to talk to. Danny Gilbert, who works with us at Healthcare Business Specialist, she'll be on the line looking for your questions to ask our speakers. So if you do have questions, type them in the question section, and Danny will look through those and ask Elizabeth or Kara about those as well. And if you have not joined our Facebook group, please do so. We're well over 2,700 members. That is the fastest way for you to get information from us, and that is the place where we post our webinars first. And so, and we tend to fill it with lots of information. And there's a lot of other great consultants on there that will answer your questions much better than I can in a lot of cases. So do join that. This is our website, ruralhealthclinic.com, and this is where you will find the recording of this session. We're going to put it on YouTube after it's over with. We've already put our presentations that we're doing today on there. And in your handouts, there are 3 handouts as well. My administrative presentation, which you don't really need, Elizabeth's presentation, which you do need, and a handout called the PMS information sheet. So there's probably a joke there somewhere, but I'm going to get myself in big trouble if I say it. So I will not say it. But this is where the presentations will be posted, and a recording will be posted here as well as in the Facebook group as well. Next week, we will be having another webinar on provider relief fund reporting. That will be on August the 18th. I think that's a Wednesday. So if you haven't reported on the provider relief fund reporting portal yet, that's due September 30th. I would not report yet. I would hang on till as long as possible before you actually hit the submit button, because we're still not real sure about some of the things that we need to put in there and some of the implications of what we put in there. So our recommendation to our clients is hold off until maybe the last week or last 2 weeks in September before you do hit that submit button to put that data in. Like I said before, questions, you can go ahead and ask us on the sidebar, and we will address those in some time after the session here. Disclaimer, this is being recorded, so if you don't like it being recorded, you're more than welcome to leave. The information is current as of today, and unfortunately, my crystal ball has not been that accurate over the last 18 months due to the pandemic. Elizabeth is probably a lot better than mine as far as the crystal ball goes. So, and Elizabeth is our speaker here. She's a lawyer from Indiana, which I've known for many years now. I think we got together in Greene County, Indiana, many years ago, and so she does a absolute fantastic job on working with FQHC. So anybody asks me about FQHCs and about how they work, I always just say talk to Elizabeth. That's your go-to person there. And grants, she understands grants and how to get those as well. And what I'm going to do is not take up any more of your time and make Elizabeth your presenter. And she has her presentation here. So you want to, yes, I'm absolutely sure I want to make you the presenter. So Elizabeth, you're in control.
Perfect. Well, just to start off, thank you all for joining. I'm just going to go through the 4 things that we're going to address today. First is payment management system, which yes, we said the initials are appropriate. PMS. It is not a. It will be a pain in your side, but it is a necessary evil to get your money. So I had a lot of people after the awards were made emailing me and texting me saying, "Why hasn't the money went into my account?" Well, that has been happening with provider relief funds and some other funding opportunities that Mark mentioned. However, it's not the case with the grant. And Kara, Kara works with me at Burris Consulting, and all my clients kind of use her to help with payment management system. And she's going to go through that for you. We're also going to talk about the FFR reports, which are the main reporting requirements that you have. And again, those are from your NOA, your notice of award that we talked about on Tuesday. The deadlines for those can be found on your notice of award. So I would mark those in my calendar today so I have them and you don't miss those deadlines. A lot of people say, well, I figure the government will remind me. The government will remind you when to change your password, but I cannot guarantee that the government will remind you when your reports are due. But they will not be happy if you don't make the deadlines. So make sure you mark based on your NOA when those FFR reports are due. We're also going to talk about documentation requirements, and I'm going to address that, as well as the new funding opportunity through USDA that was announced today. It was supposed to be announced at the end of last week, but it actually got announced today. So we updated our slides, and I talked to Mark, and he said, sure, we could address that. So when he says it is up to date as of August 12th, I am going to be sharing the latest information we have about that new grant opportunity. So at this point, I'm going to turn it over to Kara, who is also in rural Indiana, to share with you about the payment management system and the FFR reporting.
Okay, so once you have created your username, I just would like to go over your next steps because creating your username, unfortunately, does not give you the access that you need in payment management system. And I know previously we have had individuals who thought once their username was created, they would automatically have the access or be linked. And that's unfortunately not the case. So you are simply going to fill out the PMS access request form.
Just a second, are you seeing my presentation, Mark? Okay, you're muted. Okay, hold on, I'm having a little bit of issue. Will you give me access again to reshare that? I'm sorry.
Okay, oh yeah, sorry, I'll unmute myself. Okay, let me go back and let me see here, make another attendee. Okay, and you're gone off of my list here.
Yeah, I'm not for sure. Sorry, everyone. We're going to pull the screen up. I want you guys to be able to see the slides because this is very, very detailed. Okay. Not that I don't want you to see Kara's face, but.
Do you want me to move it to Kara's?
Or you can pull it up. It doesn't matter.
Okay, let's see. Make Kara. Okay, I'm gonna make you the presenter, Kara. How about that? Will that work?
Yeah. Hold on one second. Let me decide which screen it's on. So. Okay.
Or now I have a here. Now I have the. Okay, there we go. Great.
Can you see my slide?
Yes.
Okay, I think it is on. Please, did it go away?
Yep, you're fine.
Okay, so you can see it. Okay, just want to make sure my screen it changed. So you will need to fill out the PMS access request form. This is going to consist of your organization information, such as your EIN, and also the PAN, which we're going to talk about in a second. And you'll need to have these, and they must exist in the PMS system. So they must be actually the ones on your grant. Make sure of that, because otherwise they won't be approved. So when you are providing this information, you'll need to just select the yes option for all accounts. So it might set up more than one account. I believe some of you have already noticed this. You have a B account and a P account, and we're going to address that later in the presentation, but you'll need to select yes for all accounts. If the answer is actually no, and you wouldn't need both accounts, which You probably will, unless your organization has multiple. You should input the individual PAN numbers that you require access to. You're also going to use your user contact information, including the work address and telephone number. It's important you provide all of this information. Don't put not applicable, don't leave it blank, don't put your home information, because they are going to come back and verify that. So it's very important that you fill this out correctly, even though I know it might seem like it's not important. It is very important in their system. Any little error and they will reject it. So you're also going to select the type of access you require. So if you are requiring you want to do the financial reporting, you're going to click that. If you just need view only access, you're going to click that. What I recommend is you always go ahead and just click that you need all access, because probably if you're filling this out, that's what you're wanting anyway. So go ahead, give yourself full access from the get-go. It's a lot easier to do it up front than to go back and change it later. You need to include your supervisor's information, and that includes, even if you are the CEO and you're requesting the information, you need to put your own information in there, because they're going to come back and verify that information. If you leave it blank, they're going to reject it. If you don't put, the title, the email, and the phone number, they're going to reject it. So you have to fill that out completely, even if it's your own information, and that is okay if it is. Okay, so the PAN or PAN is the payee account number. You will need this to search for your cash transaction reports and to search for the federal financial report. The FFR report is the federal financial report, which we're going to talk about later. Your cash transaction report is how you would actually request the funds. So it's also very important. So you're going to need your payee account number no matter what. Also, I want to go ahead and note, and I'm going to say this throughout the presentation, it's okay to call the help desk. I call the help desk on PMS all the time just to check. They are very helpful for the most part. Every once in a while, you might need to call back, get clarification. I'm not going to say some aren't more helpful than others, as is almost always the case, but it's okay to call them. But when you do call them, they're going to want your payee account number every time. So just have it ready, have it memorized, have it, a sticky note on your desktop. You're going to need it all the time. So it's very, very important. So once you do set up your account, where can you go to easily access your payee account number? Because you lost your sticky note, or you forgot, or you're just not sure. So you're going to log in, and you're going to click a little home icon. It's going to look like a house, and you're going to see 1 to 3 notifications on there. So they're going to be like 1, 2, 3 labeled. You're going to click the magnifying glass in the corner under 3, and it's going to be payee accounts. This is where many of you have said, I have 2 accounts. Why do I have 2? Why do I have the exact same number, but one ends in a B1 and one ends in a P1? So I did call to verify, because even if you read the manual inside out, you're still not exactly sure why there are 2 accounts. I still can't really tell you why there are 2 accounts, other than HRSA has given you 2 accounts, or whatever grant entity you are going through has given you these 2 accounts. So you're always, we'll talk about that later, but you're always going to end up using like your P account, because it is for quarterly reporting, which is what you are required to do here for your FFR reports. And Elizabeth's going to talk more about reporting later, but that's where you're going to be. You're always going to be in your P1 account. So whatever your PAN is, if it's A7723, P1, that's the account you're going to click on. That's what you're going to do your reporting through. That's where you're going to request your money through. Again, if you get confused, you're not sure, call PMS. They will help you through that. They can see which account the money is under. So they'll say, well, I can see you have, such and such grant under your P1 account. So then you will know and you'll have clarification. So don't hesitate to call them. They are helpful. You usually don't wait even hardly on the line. You just click and usually you're directed pretty much immediately. So it's really worth your time to call them. So your username's created. Now what are you going to do? Once your request has been initiated, so your request for access, you've filled out your form, you've sent it in, maybe you've even called to verify, they're going to be calling your supervisor or you and going through all of this. So it's going to take a little time. I think usually a week is typically where I've seen it. Every once in a while you can get really lucky and it's 48, 72 hours, but usually a week. You're going to need to keep your request ID. So once you submit that, it's going to generate. Go ahead and keep that, because when you call back to follow up, you can have that request ID. You'll also need to keep it to input that request ID to retrieve your existing request, so you can actually check on it yourself too without calling. Or, and this is really important, to make a correction, because it is likely you may have missed something, or something just might not, there might have been a typo and you're going to have to make a correction. You need that request ID to make that correction. So you're going to have to call, they're going to have to find it, or you can just have it ready. So save that, please. It will save you a lot of time and headache later. So before you're granted access, again, and I'm sorry I'm repeating myself, but this is really important, the listed supervisor must verify all the information. So I have had this happen where, you've submitted it, you're waiting, maybe the CEO misses that email. They overlook it, they're on vacation, whatever, and they haven't verified it in the system. You're not getting access until they do. So then your access request is just on hold indefinitely. So it's very important that you notify your supervisor, or that you're watching yourself, or you're having someone watch your email if you're out on vacation, out on leave, because it has to be verified or you're not going to get your access to your PMS account. So please, please, please pay attention to that. Notify whoever you put down. Let them know, hey, you have to watch for this email. You have to verify this information as soon as possible. So all users are also required to self-certify annually in the system. So you will need to be watching for that notification as well. I would suggest looking for it also in the PMS system and not just your email, just in case it slides over to your junk folder or something, just in case they don't send out a notification that time. Just be watching your account and know that once a year, you're going to have to go in and self-certify. And your grant periods are usually going to be at least a year, not all of them, but some of them. So you're going to have to do that, and you're going to be expected to do that. Okay, so now you have your access, everything's verified. You're going to need to add or update your banking information as well. So there is a form, the direct deposit form, that must be completed and uploaded for every banking request. So even if you had access to the PMS system, lost it, maybe it was deactivated a few years ago, you're going to have to renew that, and you're going to have to refill out this form every single time. Every time you add a bank, every time you add a user, you're going to have to do this form. You need to follow all instructions on this form. They're extremely particular with the 1199A. They are very particular. It's also not always super clear, and you're having the bank fill out part of it because they want signatures here, there, and yonder. And they're very particular about what information is provided. So once you do submit this form, I suggest you are checking every 48 hours to see if it goes through, because they're not going to just notify you that it was denied. It's just going to sit in there denied. Okay? If it is denied, there should be a reason provided. If you do not understand the reason at all, or you're unsure, call them. They can explain why you were denied, and they will do that. And it's very, very helpful, because sometimes the information is a little unclear. Sometimes the signature just was unclear, or it was blurry, or they didn't like it, whatever. So you need to call, be checking on that, I would say every 48 hours until it does get approved. That's my recommendation, because you're going to get your money faster that way. And what do we all want? We want our money. You know, we are ready for these funds. We're already waiting. So please, please, please be checking on that every 48 hours if possible, just to make sure that the information is correct. Pick up the phone, call them, find out why it was denied, fix it, get it back in immediately. Okay. We're going to provide instructions from the website, and those are the forms you've been told about. So please check those out. We're trying to be helpful, trying to send it to you so that you don't, you know, your form isn't rejected the first time. So please check those out. Feel free, take advantage. Okay, so here's where we're going to talk a little more about the B1 accounts and the P1 accounts. So which do you use? Okay, I just verified this as of 8/6 with PMS, just to make sure. I just wanted a verbal confirmation, as well as, you know, just my knowledge from what we've done with previous clients. And the P1 accounts are always, always, always used for your quarterly reporting, your FFR quarterly reports, which is what you're required to use. So your funds should be under your P1 account. Again, you can call and verify this. They can see which account the money is under, and they can tell you, but it should always be your P1 account. Why that B1 account is in there too, I can't really answer that for you. It just is. Okay, so quarterly FFR reports. So here are the dates in there. If you could check those out, please mark them down. I'm not going to tell you that the notification reminding you about those reports is the most helpful. It's not. You need to know when to do these reports. You need to be going in there and being proactive in filling out these reports. Don't wait on the notification. Just go in there, have it on your calendar, have it on your assistant's calendar, have reminders, get them in, okay? So 3/31, 6/30, 9/30, 12/31. You're filling out those reports. At the end of the award agreement, so once your project's completed, you will have a final FFR report to submit as well. So just know that and be ready for that, because you're not going to be able to close everything out until that report is submitted. And that's one that sometimes clients fail to submit. They think they're done. They're not worried about it. You're not done until that final report is submitted. Elizabeth can tell you that. You know, we've had a client did not know why they could not close this out, and it's because they were not finishing and completing their final FFR report. So to see all your FFR reports, you're going to go to that home icon again. It looks like a house. You're going to click disbursement, and you're going to click on the FFR grantee user guide, and it's going to just walk you through the process on how to see your FFR reports, how to print your FFR reports. It's just going to walk you through that. It's very instructive. Please use it. Please take advantage of it. For your FFR reports, this is also important. This is where people also get stuck. So they filled out their FFR reports, they prepared them. So when you go in, like that's the option, you're going to click on prepare, and then you're going to work on your report. Okay, that's where people sometimes think, then I'm done, I prepared my report. That's not the final step. You actually have to click certify that report. So not only do you have to prepare the report and complete it, you have to go in also and certify it. If you do not, then it doesn't count. It doesn't make it there. You're not finished. You know, if you waited till 6:30 to finish that quarterly report and you didn't finish it, it's going to be late if you don't click that certify on 6:30. So once the agency does approve your report, the status in the report workflow section will change to complete. So you'll be able to see that it's completed. If you don't see that, it's not done yet and it's not been approved yet. So make sure not only was it actually done, that it has been approved. You can then access it and print the report so that you can keep a copy for yourself, for your own records. Okay. And now it looks like I'm going to turn it over to Elizabeth.
Thank you. And I just want to emphasize the FFR reports, you're only reporting on this grant money. You're not reporting on all your program income. So it's just how much you drew down that quarter. Do not make those reports complicated. It is literally how much you drew down and what category you spent them on. And when you certify, it's almost like you have to double and triple certify because you think you're done and then you're not done. And then you have to click certify and then submit. And it's like extra, you've got to click it. And even some of our top clients who are very grant literate just recently wasted 3 days wondering what was going on and spent time on hold. And it was because they were not clicking certify in the right spot and then submitting. So again, we can't emphasize that enough. Stay on top of these reports, but do not make them complicated. Really, they should take 10 minutes, each of your FFR reports. This is not difficult. It's not rocket science. It doesn't need to have an accountant to do it. I've done them. I'm not an accountant. So, you know, it's just what categories you spent your money on. Okay, documentation. I've had a lot of people ask me about documentation. Do I need receipts? Do I need proper invoicing, purchase orders? What do I need to keep? Okay, here's what I'm going to tell you. One, assuming you have not purchased any equipment, which is if you've listened to me at all, you're not going to purchase anything over $5,000 for a one item acquisition item. If you have to do that, there's a lot more documentation. You have to do an SF-424 or SF-428 and SF-428A, and you have additional documentation after that. So don't do that. I've said it before, but I'm going to say it again. If you are listening to me, don't go buy a vehicle. Don't go buy an expensive something that costs over $5,000 for one item. You know, yes, you can buy 4 new exam beds that you're going to give vaccines on because each of those items don't cost over $5,000, but you don't want to do that. You don't also have to submit any receipts or documentation to HRSA. There's no place that Kara was just talking about in payment management system. I've had a couple questions through email about that. Do I have to scan my receipts in and post them somewhere? No. But you do have to keep receipts and you do have to keep documentation. If you have questions, the people to ask on this are not a helpline, but rather a CPA or an auditor. You do have your financial management grants person that's on your NOA, but honestly, they are just there kind of if you're having issues or if you want to change your budget. They're probably not going to provide you the answers that you want. So whoever does your audit or whoever helps you with your CPA, and I'm not saying to bug Mark, I'm saying whoever does your local audit, not your cost report necessarily, you can ask them. Consult them to see what documentation they want, but I can pretty much tell you what I think they're going to say. They're going to say if you purchase supplies, keep a receipt of any of those supplies. Keep in mind you're not to purchase vaccine supplies. That's not allowable. This is a vaccine confidence supply. So if you're doing flyers, patient education, a billboard, social media campaign, somehow keep receipts of that if those things cost you money. You again aren't going to upload them, but just in case after the grant. I was on a call yesterday where HRSA was explaining they can ask for things up to 3 years after the grant is closed out. So keep in mind, grant's going to close out in 2022. You need it till 2025. If your policies, if your financial policies say that you keep grant documentation longer, make sure to follow those policies, because if you promise them for 5 years, you should keep them for 5 years. Again, we all have computerized systems. This shouldn't be that difficult to make sure you keep a file, Excel sheet. This is where I spent my money. Here's the receipts. Again, don't complicate it. If you are using payroll, which I'll be honest is the easiest thing to document, because in some form or fashion, you are currently documenting payroll. You have to have people show their time. You need to estimate the time or percentage as best you can that they are spending on vaccine education or increasing access to rural health. Now, you're listening to me, right? That's pretty vague. We read that on Tuesday, that these are what HRSA wants. So I think most of any of your clinical staff are helping increase access to rural health, and they're probably answering vaccine questions all the time. I went to breakfast with one of my best friends today, and I felt like 90% of our hour-and-a-half conversation was about the COVID vaccine, even though she doesn't even work in healthcare. It was just our general conversation. So, you know, any of that time can be allotted. Does that mean that I have to hurry up and write down, okay, I spent 5 minutes out of 30 talking about that? No, you do the best estimate that you can and you track that. If your payroll system can track it, and it might say Kara spends 60% on vaccine confidence and 40% on other, have her sign off on that. That's how her payroll's divided. I even did old school. We just had people literally hand sign if they were paid out of the grant, that this is the percentage paid out of the grant. This is the percentage not paid out of the grant. If you're paying somebody 100%, just have them sign it, keep their payroll sheet if you can mark that through your system. I am familiar with Kronos, and I think what's the other big one that people use a lot? I can't remember. It's a national company, but anyway, they both do have ways that you can allocate time. And, you know, you just say 60% to one, 40%, or however you've divided it. Don't stress over it. You have to have some sort of payroll documentation. Use that. Use that for your grant if needed, and don't get yourself worked up, really. But again, you have that as backup, and you definitely keep that 3 years post the close of the grant. Now, again, if you listen to me on Tuesday, you're not going to ask for an extension. But if you do ask for an extension, even though I told you not to, and you extend that grant with a no-cost extension until 2023, that means you have to keep your documentation 3 years after the grant is closed out, which would be 2026. If you fail to listen to Kara and you don't do your FFR reports, like we've had clients that sometimes we got hired after the fact because they had done no reporting over a 5-year grant. We had to clean up a mess. You know, we're glad to help people, but that was really hard work and we learned a lot through it. But, you know, you have to do those reports to close out your grant. If you're not doing those reports and eventually spending and then closing out your grant, keep in mind the documentation must be kept longer. And so, again, keep it as simple as possible. You know, if you're going to make a big order through Amazon for supplies, just if you're paying out of the grant, keep that order separate. Do it as easy as you can, so later you don't have the headache of reporting on this $49,000 some dollars and saying, I remember this girl talking us into applying for this grant. Now I wish we would have never done that. I definitely don't want that to be the case. And I'm going to emphasize again, I still have a few people who are writing me saying, I swear my SAM is fixed, but I still haven't got my notice of award. Write L. Dixon at nosor.org. Go to the RHCVC Confidence HRSA page. Email me, email Mark. Mark can forward it to me. I don't care who you contact, but you should be getting that. There is something on the back end that even though it might be showing you that your SAM is right, it's not showing the federal government. And that is, I think, the reason 95% of people that I wrote for, I think there was a handful that did not get the grant. Almost all of them, it was because of that one issue. Somehow SAM showed them it was fine, but it wasn't. So if you were waiting till the last minute on your SAM and had issues and they did the work through to help you get it submitted, that's probably why you don't have your notice of award, and you should get that. Reach out to me, NOSOR. If you need to go to National Association of Rural Health Clinics, any of us are going to help you because we want you to get that money. If you have specific questions about documentation, you can always reach out to me. But again, just to emphasize, you need those policies for your grant. Follow your policies, keep track of your documentation. And now we can talk about the fun thing about the grant, but I'm going to throw one other thing in there too. I've had a few of you ask me, do I need a separate bank account for this grant? No, you don't. You can. It doesn't matter. HRSA doesn't care if it's account that's just for grants or if it's not. In the FQHC world, if you ever worked in that world before you entered the RHC world, there are a lot of FQHCs that do have a separate grant bank account that draw it over and then move it in. I don't know how that ever started. I think there was a national speaker that suggested that. There's no requirement for having separate bank accounts. If you want it, great. If you don't, great. If I were you, I would just use my bank account, attach it to the payment management system like Kara explained, and use that. You do have to draw down your payment though, either and spend it within 48 hours or or ask for the reimbursement. If I were you, I would ask for the reimbursement, or if I'm paying payroll, I might request it the day before payroll is going to hit my bank account, because you're not allowed to make interest off of grant money. That's why that's the case. If so, you create headaches for CPAs that they don't want, and you can get in trouble. So just always ask for reimbursement or spend it within 48 hours. Okay, sorry. Okay, now the fun thing. This is what I get real excited about. All you guys know, grants make me really excited, especially when it's for rural healthcare, and there has been little money given to rural healthcare recently. So this is really, really, really exciting. So I'm just going to say 500 million a few times. 500 million, and yes, this is one that can be used for facilities. And a lot of you have given me your sob stories, and I want you to get a new facility. I don't want people working out of trailers, modular units, or things that have been flooded. I've gotten a lot of sob stories today already, and yes, we want to help you. This is the link to the new USDA grant. You can go to that page. The page is live. There are 2 webinars next week that you can sign up for. I'm already signed up. I encourage you to sign up. And so those are free. The grant, I've been asked a lot, is it for profit and non-for-profit? It is for nonprofit community-based organizations, or for towns, communities, townships, or counties. So any form of local government. So one example that I was sharing with Mark earlier before the call was that we were able to get funding through our local town. So the town received the grant. It was just a pass through, and they passed it right to our clinic for a brand new septic system. So for USDA, it can pay up to 75% of your project, and it's based on your town or your area or your county or your service area, multiple counties poverty level. And USDA will work to help you on that. The application, it's a different form of application. There's a lot of paperwork to do, and you work with your local USDA office. I'm going to self-promote now. If you want help with that paperwork, feel free to contact us. There's a special place in my heart for USDA. I worked there all 4 summers of college, and I love it. It is for, as we said, COVID-19 testing and vaccines, or rural healthcare services, or food assistance. Something that definitely, those are all social determinants of health issues that you guys deal with every day. And this is all grant money. So if you've dealt with USDA in the past, it's often a grant loan combo. This is 500 million for grants. What I've mainly been talking about is the track 1. Track 2, you do have to have partnerships. So it can't just be your clinic on its own applying, but how many of us work in silos on our own? I bet you have a partner with the local hospital, another clinic, the health department, the food bank, the YMCA, or all the other multiple people that you work with. So you do have to have some sort of a consortium partnership for track 2. So I'm sure more information will be coming out about this. Again, it was just announced today. It was supposed to be announced last week. It is due October 12th. So 2 months from today, which will be here as soon as we know it. So don't let this, because this does require quite a bit of paperwork. This is not one that you can wait and pull off in 48 hours. Some of you know this one requires some different plans, and for facilities and stuff, there's different requirements. So please, please, please make sure that you start if this is even something you want to think about, start looking at it, start working on it. Reach out to your local USDA office, however that is needed. And again, I encourage you to find out your local office, rd.usda.gov. If they aren't responsive, go on up to your state level people, and they will be very helpful. And from what I understand from my friend that still works at USDA at the state level, she said they are being encouraged to get this money out the door. This is a huge amount for USDA to have that is not going to farmers or school lunches. So they want to be effective in promoting this. There is a preference given for places that do integrated care, in other words, primary and behavioral or primary and substance abuse care, or offers various services, a food bank, homeless shelter, and a clinic or something like that. So again, think outside the box and think of what you want to do. If you've been considering doing integrated care, it's something I'm passionate about, this may be your time to get started on that. Okay, I think that's all I have on that. We'll put up our contact information. So if you want help on this grant, If you need extra help with payment management system, or if you have questions, feel free to reach out to us. If you want to, I've had a lot of people ask me, I want to know about future grants. I'm trying to send those out. Kara was hunting some grants and sending them to me for different states, and I was trying to get those to the right states today. So if you want to be a part of that, we'll let you know. And of course, Mark tries to keep you updated on his Facebook page, and we try to respond to anything there. And now, Danny, do we have any questions for Kara or me?
Yes, ma'am. There are a few. First question is, where do we access the PMS access request form?
Kara, you're muted.
Okay, that is accessible on the site. So once your username's created, you will go in and you will be able to access that form.
Okay. The dates that you showed, are they the standard?
The link to the payment management system site is on their notice of award. Or I'm pretty sure if you Google HRSA payment management system, it'll pop up, but there is a link on their notice of award.
Okay. The standard reporting dates that you showed, or the dates that you showed, are they the standard reporting dates? Because they are not the same dates that are on her notice of award.
Okay.
Do what is on your notice of award. Those are the standard dates, but if your notice of award says something different, do whatever is on your notice of award.
All right, and there's one more so far. If the nurse in our COVID vaccine screening education area of the clinic actually administers the vaccine and we bill for it, is that double dipping if we include that salary in the grant since we're being paid for the administration elsewhere?
Okay, it's not double dipping. You can bill for any services paid by a grant, but this specific grant cannot pay for someone to put shots in arms. Okay, so you probably can use your provider relief funds or other funds for that. Now, any education this nurse does, if she's going to health fairs a day a week or going to the schools and promoting vaccine or churches or whatever, that's fine, but you cannot pay for hours of shots in arms. You can pay for the person to schedule the appointment. You can pay for the MA to walk them out of the clinic. You can pay for the doctor to review them after or whatever it is, but you cannot pay for a shot in an arm with this particular grant. And then, yeah, but okay, let's say hypothetically you're doing education, but then they also see the provider. Yes, you can bill for that. That is completely legal and allowable. And I know I'm just going to beat Mark to his punch, which is any of the costs that you do that are allowable costs for an RHC that are paid by a grant are allowable on your cost report. So again, marketing is not allowable, but outreach and education is, so just keep that in mind. And again, yeah, it doesn't matter if it's paid by a grant or paid by you, but yes, you can still bill for any of those services provided by a nurse practitioner or something like that, just not shots in arms.
Okay. I think that's all the questions that have been coming so far. There are none in the chat box. So Mark, I don't know if you want to chime in, if you've seen any that I missed.
I know, I was just looking through there and you got them all. We only had 4 questions today, which is not a lot. That's great. I think everybody either really understands this better than I do, or it's money. We'll figure it out whenever we get into the portal. But thank you, Elizabeth. Thank you, Kara, for doing this. It's been very helpful. Elizabeth, are you willing to come back in a couple of weeks after you've had a little chance to review this? $500 million got the CPA in me sort of all hyped up about that. And so, and it sounds
especially for facilities. And I know our rural health clinics really need facilities because they are important to making sure we deliver high quality health care in rural areas. So definitely.
And the way I understood you to say it, and correct me if I'm wrong, is that first thing I heard was, well, it has to be not for profit, but if we're a for-profit and we link up with our county or local government and they're a not-for-profit, we can sort of run the grant through them, and then it can be funneled into our for-profit entity to buy that facility or whatever. So it doesn't, just because you're not a not-for-profit doesn't preclude you from participating in getting this $500 million. Is that correct?
That's correct.
Okay.
Definitely. So if you have friends in high places or low places in county, township government, town government, or county commissioners, any of those local elected officials, you will want to start talking to them as well if you're for profit, because yes, they can do that.
Okay. And let me see here. Is there another question, Danny? I saw something. Oh yeah, if you want to re-listen to this meeting, how do I do that? It's gonna, like I said, we have it recorded. It's gonna be in the Facebook group, the Rural Health Clinic Information Exchange Facebook group. I'll put the link there. I'll also put the link on our website at ruralhealthclinic.com/COVID-19. There will be a place for you to watch. It'll be on YouTube, so you can subscribe to our YouTube channel. I am definitely not a YouTube star yet. Most of our stuff gets about 20 views, but you're more. That's the place where it's going to be. So all right. I think that's Danny. Do you have any more questions before we move on, or anything?
There were a couple that came in. If y'all got it, just a couple minutes.
Sure.
Sue asked, "Can I change the project director?"
Yes, you would have to go through you'll have to go to HRSA electronic handbook, get signed up for your organization and yourself, and then you have to ask for a change in project director. It's actually on the front page. There's a link that you can click on that to change that. And if you have questions specifically about that, you can reach out, or you can, but go to that. There's on your NOA is a little paragraph about the HRSA electronic handbook. So go and try to do that. And they have a lot of YouTube videos to help you too that can link that HRSA has done. And also I would reach out to the grant program contact, which is probably a person named Lindsay. That's the ones I've seen the most. But whoever is your grant contact, and just let them know you're changing project directors. Keep in mind though, payment management system is going to think it's the first person until everything is changed, and that takes a while with the government to get all their systems talking and updating. So just be aware of that. So if you can keep the current one, honestly, that makes it easier. But if you really do need to change, go through those proper steps.
Okay, thank you. The last one, based on the information emailed today, it appears the USDA grant retros to 3/13/2020.
Yes, I still have to read all the fine print, but yes, I believe that's what it said, and because it does go back to any costs incurred through the pandemic. So. But also keep in mind, this grant is not solely COVID-19. It is for things to address COVID-19, but it also is for things to strategically expand rural healthcare services. So, but yes, I'll be able to answer that better here in a week or two after USDA even digests it a little more. But yes, it's supposed to retro back to when the government shut down, or when the world shut down, I guess.
Okay.
So Elizabeth, I guess we can, after USDA has their webinars and their information there, I guess can we come back and do one of these again for our folks? And okay, so we will do that. We'll get the word out in a few weeks on this USDA, because you don't have a lot of time, because you are going to be working with other entities. Like Elizabeth said, October 12th, 2021 will be here in a flash. And so we'll definitely want to get the word out as quickly as possible to help people do this. So Kara, Elizabeth, Danny, thank y'all very much. Everybody have a great rest of your day. And thank you for what you're doing. Stay safe out there. I know this Delta variant it's a bad thing. We've got 3 or 4 of our people from our relatively small church that are in the ICU right now due to COVID-19. So it's very scary. So thank you for what you're doing, and we'll see you later. Bye, everybody.